Hello, this is Luis. Welcome to the HDTV updates from the 58th EASD 2022 annual meeting. Today we bring you the Day 4 updates of EASD 2022. In introducing the new consensus statement, Robert Gabay called it perhaps the best yet. The most recent update to the ADA and EASD Hyperglycemia Management Consensus Report emphasizes holistic, person-centered care for type 2 diabetes patients. Cardiorenal protection, cardiovascular risk factor management, weight management, and blood glucose management are all important components of holistic care. It is worth noting that the statement no longer recommends metformin as the first-line medication for type 2 diabetes, acknowledging that other medications may be more appropriate where there is a strong need to reduce cardiovascular and/or renal risk or lose weight. Busey concluded that we believe that emphatic, person-centered decision-making and support that is informed by an understanding of local resources and individual social determinants of health is essential. Marks led a session in which he emphasized that SGLT2 inhibitors are a novel treatment option for all heart failure patients, diabetic or not, regardless of ejection fraction. SGLT2 inhibitors' beneficial effects are mediated by a number of mechanisms. Despite the exclusion of patients with HFrEF, finerenone reduces hospitalization for heart failure in patients with diabetes and CKD. Lundell presented a session that demonstrated that SGLT2 inhibitors and GLP-1 receptor agonists are associated with lower mortality in younger people with type 2 diabetes and a first myocardial infarction. It was concluded that the use of an SGLT2 inhibitor or a GLP-1 receptor agonist was associated with a lower 5-year mortality rate. Lund concluded during a session at the EASD-ESC Symposium that type 2 diabetes increases the risk of heart failure, particularly HFpEF. Systemic inflammation and microvascular endothelial function are thought to be involved, leading to altered metabolism and cardiac fibrosis, stiffness and impaired relaxation, as well as vascular kidney and multi-organ involvement. These mechanisms may be particularly suited to treatment with SGLT2 inhibitors and emerging agents for type 2 diabetes, obesity, or metabolic syndrome. Savikic led a session that resulted in a comprehensive evaluation of multi-tissue, metabolomic, and skeletal muscle proteomic responses to training at different times of day in men with type 2 diabetes. Morning and afternoon high-intensity interval training were associated with increased circulating lipids and changes in adipose tissue lipid composition. However, afternoon high-intensity training increased skeletal muscle lipids and mitochondrial composition more than morning training. This diurnal component of the metabolomic and proteomic training response may be clinically relevant and warrants further investigation. This concludes our coverage of the HDTV updates for Day 4 of the EASD 2022. We'll meet again next year at EASD 2023.